We're really excited to have Dr. Brandon Lee join us today. In case you weren't at the Global Specialty Lens Symposium this year, he's here to present his poster, Filamentary Keratitis and Sjögren's Management with Scleral Lenses. Dr. Brandon Lee is currently serving as the clinical teaching fellow with the City of Houston Health Department and the University of Houston College of Optometry.
I presented this poster at GSLS earlier this year in January. And it was just managing this particular condition, filamentary keratitis, from Sjögren's with the use of scleral lenses, specifically with visionary optics lenses. So Sjögren's syndrome, just in general, it's an autoimmune disorder, and it's characterized by this inflammation or lymphocytic infiltrates in the exocrine glands. So that includes, the eyes as well as like your sweat glands and your salivary glands too. So because it's, can cause dryness, it can be severe enough to cause filamentary keratitis. And that mechanical friction from the severe amount of dryness from this inflammation can cause this buildup of like this mucoid or these filaments on the ocular surface. And it can be really, painful, irritating, burning for the patients who experience it. Filamentary keratitis, as we all probably know, is not necessarily exclusive to Sjogren's, but the cause of dryness can really be anything as long as it's severe enough. And if anybody's dealt with patients with Sjogren's, it can very easily get severe enough, even under, proper management from a rheumatologist. So we try to treat them the best we can. So with that being said, we do have a 44-year-old female that came into our clinic. She came in with this complaint of just constant eye pain. It's red. She's very light sensitive, and you can see from those pictures, she has a really hard time opening her eyes under the slit lamp, especially with that bright blue light there. And just this general feeling of greediness, and this is in both eyes too. So this is a table of all the lenses that we tried. So the first one was a diagnostic lens, and the fit set that we have specifically was a Europa Tangent. And we just made these appropriate changes just depending on the fit that we saw, the initial fit. Overall, I mean, it looks okay. You can kind of see in the middle picture that top part, and it looked the same for both eyes, even though this is just the right eye. Not the terribly difficult cornea or irregular astigmatism or any kind of cone. So that top part is thinner on the amount of central clearance that it has. But overall, the landing zone and everything looked pretty good. Or the next visit, this is about a week later. The central clearance is much more, even throughout, the inferior and superior portion of the lens on the cornea. The deposits are still there, but overall, it's looking pretty good. There's good enough limbal clearance all around you, but everything looks a lot better in terms of the fit. And she feels more comfortable too. So I felt comfortable, dispensing this. She was still like 20, 25, 20, 30, 20, 20-ish. Kind of fluctuates depending on how bad the deposits were and how much dryness she was experiencing there. So we also changed the materials as well. So that way there wasn't as much deposit buildup too. This was based on the recommendations of the consultation. On the HydraPeg, obviously, the HydraPeg coating, helped quite a bit. So this is the final fit here. There's still that neovascularization. Unfortunately, it's just gonna linger a little bit even with the steroids that we put her on. She expressed a lot more comfort. She barely felt the lens at all, if at all. Landing zone was great. It fit really well. The centration was great altogether. And she was actually 20/20 at this visit. Thankfully with Visionary, they had a pretty good patient assistance program there. So I think we made a really good call there. Scleral lenses, they have a lot of indications. They're rapidly growing. So I think they're a great option for challenging cases of dryness or severe cases of dryness, especially for like your Sjogren syndromes patients. And moving on, like it's a chronic condition, right? It doesn't just go away. There's no treatment or a cocktail that just gets rid of the autoimmune disorder. So you do need a constant and frequent chronic management to fight this chronic disease too. So scleral lenses aren't just going to be the main thing that they put on, but you have to put them on other medications as well. So this combination of the two, I think, is really beneficial for these patients.
Well, thank you, Dr. Lee. I so appreciate your time today, and what an excellent case. You really helped change this patient's life.
Thank you. I appreciate you guys having me.